name is David F. Durr, MD. I've been a doctor for 44 years. I was born in January 27th, 1932. At the age of 6, my grandmother, she took me and my aunt out to Hong Kong, get on a boat to come to the United States. My mother didn't want me to come. So there's a friction between my mother and my aunt, who needed a son in order to get to the United States. But so my grandmother finally made my mother agreeable to the procedure of me being the paper son of my aunt. But in order to get used to the situation, I have to live with her for a few months and keep calling her mother. Now, during that time, my attempt to get back home was cut short because my brothers wouldn't open the doors for me. Sort of cut me off from my usual family and learned that I have a new family. We're taken to Angel Island, where I stayed for a few months. At the end of that period, there was a big fire at Angel Island. Because of the big fire, we were moved to San Francisco. After that, we moved to Oakland. We lived close to Chinatown, went to Lincoln School, what they call immigrant class. One of the things that I remember when I was 10 or 11 years old, my uncle had a daughter and he brought back from the hospital. But the baby, after coming home, was crying all the time. So he heard some story about getting some eucalyptus leaf, boiled it and bathed the baby in it. The next morning, the house was very quiet. I thought maybe the baby got well, but no. When I saw everyone got a sad face, you know that the baby passed away. I never forgot that. Later on, as I thought about it, all the essence of what's happening in Oakland, Chinatown with new immigrants are the same thing. Lack of language, lack of understanding, no money, no knowledge of where to go. So these are the factors that influenced me to go into medicine. The other thing that drove me was as I was finishing high school. One day, Luther Fong said, going to San Francisco City College. I went with him and he registered for pre-med. I said, what's pre-med? Well, that's when you want to become a doctor, okay? He asked me to do the same thing, because then we can go to school together. When I finished there, I transferred to UC Berkeley. Financially, it was a burden, but I heard that the Army would give you a GI Bill for education if you joined. So in 1952, I was drafted into the Army for 24 months and 2 days. I was in a hurry to get out of there. Afterward, I came back and continued on my pre-med school, and then I got a call from Dr. Raymond Ng. Raymond Ng was a well-known optometrist in Oakland, Chinatown. He was also the councilman of Oakland. So he asked me if I want to go to med school at Howard University in Washington, D.C., an Afro-American school. And after I read about Howard University, I found that it has one of the lowest tuition in the United States. So I fitted my budget, and it turned out pretty good. I live among the Afro-Americans, got to know a lot of them. I learned about their prejudice and discrimination that they face, and I said, gee, we have almost the same problem. I finished at Howard. Postgraduate, you got to go through internship. So I came back to California to Highland General Hospital. I became a chief resident. Now, if you're a chief resident at Highland, you automatically get a position at one of the local hospitals to run the emergency room for a year. I was supposed to assume that position about a week before I graduated, but then they called me in for an interview. And they saw that I was Asian, and they didn't want an Asian physician. See, my name is Der. They didn't know that's a Chinese name. Like I say, I live among the blacks, and I know what kind of treatment they get, and this is kind of treatment we get at that time.
Dr. Der is a very devoted person.
He's a surgeon, a very good surgeon, and he takes his job very seriously. He doesn't tell jokes like me. I tell dirty jokes sometimes, pardon my expression.
Dr. Der, I have known him for over 20 years. All his life, he had one goal, is always try to help other people.
In 1975 was a flood of new immigrants coming to the United States. So Oakland Chinatown was flooded with new immigrants, and there's no way for them to get medical service. And there was a community activist group, young people who decided to start a health clinic. Pastor Frank Marr heard about it and got involved with them. That was the Asian Health Service at that time. Frank Marr called me several times. I was busy and I didn't want to come down. But he finally said, "Look, you come down here, I treat you to a lunch." You know, I said, "Hey, that's the reverse. We usually treat a pastor to a lunch, you know." So I came down and I saw the situation. There indeed was a tremendous need. The only person working there was Sue Chan, Dr. Sue Chan. The place is really bare. So then I got involved and they put me on the board of trustees. You know, I came from a big clinic in Hayward, so I know the structure of what a clinic should be. Divide up the medical part from the administrative part. We have to look for an administrator. This is where serendipity comes in. One day at the meeting, I got in early. While I was waiting for a meeting to start, I sat there and watched 3 or 4 gals making posters. I noticed one gal telling everybody what to do and how to do it, and she was quite adamant about how to do it correctly. And I said, hey, maybe that's the quality we need in an administrator. So when the meeting started, I asked, who's that young lady that's doing all that? Her name was Sherry. And so I suggested her, give her a chance to become an administrator. So that was how she was hired. One day, she asked me to be at the hearing in Hayward. She was trying to get a grant from the city of Hayward. That day was stormy. It was one of the biggest rain in the year. And I said, gee, I hope they cancel the meeting or Sherry would cancel. But as I thought about that, the phone rang. It was Sherry on the other end. She said, are you going to be there, right? I said, sure, Sherry. Sure enough, she came down. If she had that demeanor to come down and do this, I know she's going to be a very good administrator. So sure, that was it. Well, I always feel that if you don't voice your opinion and try to get things going your way, you're not going to be heard and you're going to be ignored. So you push as hard as you can. One of the major reasons I formed CAPS was to support Asian health services. We actually started a medication fund for them, for those patients who do not have money to buy their medication.